Did you know you can have a completely normal MRI or CT scan after a car accident and still have severe headaches every day? If you've been in an accident and you're dealing with headaches, the headaches are not all the same, and treating the wrong type can keep you stuck. Today, I'm going to break down the 5 most common types of headaches after a car accident, what causes them, and how to start thinking about them correctly. This video is for educational purposes only and does not constitute medical advice or can constitute a doctor-patient relationship. If you're experiencing symptoms after an accident, please consult a qualified healthcare provider. The first type of headache is a direct impact type headache. This happens when your head actually hits something, the steering wheel, window, or headrest. This can cause bruising of the head areas or soft tissue injury, or even a concussion as well. The pain is often localized, one particular area, sore, throbbing, right where the impact occurred. If you hit your head and have headaches after this, this is one of the first types of headaches we consider. The second type of headache is a post-concussion headache. This doesn't always require a direct hit to the head. When your body experiences a sudden acceleration-deceleration force, it can affect how the brain functions. And the brain can actually shift inside the skull, causing trauma to the brain. This can lead to symptoms like headaches, brain fog, dizziness, light sensitivity, difficulty concentrating, irritability. Some people also develop headaches related to visual or balance issues as well, such as screen sensitivity or feeling off balance. The key thing here is that your MRI or CT scan could be normal, but you still don't feel right. The third type of headache is a cervicogenic headache. That's a headache that's coming from the neck. This happens during a car accident. The neck undergoes a whiplash-type movement. This can irritate the joints and muscles and ligaments and can cause pain that refers into the head. This type of headache often starts in the neck and travels to the back or the sides of the head, may be worse with movement. This is one of the most common types we see. The fourth type of headache is an occipital neuralgia type headache. This involves irritation to the nerves at the base of the skull. The pain typically starts at the base of the skull and travels upward and can feel sharp, burning, or electric even sometimes. Some people also have scalp tenderness and pain when touching the back of their head. This is common after a whiplash injury and is often missed. The fifth type is a tension or stress-related headache. After an accident, your body and nervous system undergoes a lot of stress. This can lead to muscle tightness in the neck, shoulders, and a dull aching type headache is common with this type of headache. Often feels like a band around the head. Tightness is often linked to stress, anxiety, poor sleep, muscle fatigue. And here's something very important. Many people don't just have one type of headache after a car accident. They have a combination. For example, a patient could have a neck-related headache, cervicogenic, plus a concussion-type headache. This type puts stress in different areas, and it's important after an accident. It can be frustrating and hard to treat. Headaches are often multifactorial, meaning there could be a combination, just like what we mentioned. It's also important to understand these headaches differ from traditional migraines. Migraines are typical primary headache disorder, meaning that they're not caused by an injury. Migraines often reported as being throbbing, pulsing, associated with nausea, vomiting, sensitivity to light and sound. Some people have to lay down for hours to get relief. Some people also experience an aura, such as a visual disturbance before the headache starts. In contrast, headaches after a car accident are often secondary to the injury itself. They are common related to neck injury, concussion, nerve irritation, muscle tension, and the pattern of pain is often different. Now, some people who already have migraines may find that an accident triggers or worsens them. But in some cases, the headaches we see after an accident are completely, entirely different and should be evaluated that way. If you're experiencing any of these symptoms after an accident, you should seek medical attention immediately. Worsening or severe headaches, loss of consciousness, vomiting, confusion or memory issues, slurred speech, weakness or numbness, vision changes. Don't ignore these. Get evaluated right away. Most important to understand this: not all headaches after a car accident are the same, and many times they're caused by more than one factor at the same time. If you don't identify the cause correctly, you may not get the right treatment. If you've been injured in a car accident and you're dealing with headaches, understanding the type of headache you have is the first step towards recovery. If you found this helpful, this video, share it with somebody that's going through something similar to what you're going through. And remember, just because the imaging is normal or doesn't show something, that doesn't mean that what you're feeling isn't real. And remember, like, follow, subscribe. See you on the other side.